New Mexico has a chronic shortage of doctors, and that's likely to worsen with doctors retiring and more people accessing medical services through the Affordable Care Act. Now, a new privately funded medical school is in the works for Las Cruces and looks to put a dent in that problem. The plan is to start turning out 150 new osteopathic doctors annually beginning in 2020. Joining me to talk about this subject, we have line regular Rob Nikolewski of the New Mexico Watchdog. Also here this week is line regular Laura Sanchez-Rive of Sanchez Legal Solutions. And returning once more to the table is Harry Van Buren, professor with the Anderson School of Management. The $85 million for-profit school is backed by New Mexico investors, and many are enthusiastic about the economic impact this could have on the state. But there are many questions out there. Will it impact graduates from the existing medical schools at the University of New Mexico, who will be competing with these graduates for limited residency positions? And Laura, I gotta say right here, there's also the debt load. I did not realize that for I'm gonna call them OROP people for short, the average, the median was about $260,000 worth of debt load. That's an amazing amount of money. Let's start there. We're putting all these kids to this private school. How do you make money after the fact when you've got that kind of debt load, let alone doing good work for the
right.
populace?
I mean, that's a huge constraint. Mm-hmm. So I think the solution in situations like that, in addressing rural health needs and the debt load issue, is to come up with programs where people have an incentive to go work in rural areas, underserved communities, in order to get some of that debt forgiven. And there are existing programs now. I think they would need to be expanded. In this particular program, or the new school that they're proposing, just in reading some of the facts related to our current health state down there, what I read was that they have something like 320 doctors in the Las Cruces area, or in the southern New Mexico region. More than 100 of them are at or above retirement age.
Wow.
So that means that very soon we're going to experience even more of a shortage than we already have. So this is hopefully an injection of some new, younger students coming through. It's still in the works, so they're still trying to work that out. But they are developing some private public partnerships in order to not just create a new school where you're training new people to come out and then look for residencies. They're also trying to develop more residencies, so more opportunities for those residencies. So hopefully that will mean for the UNM students coming out also more opportunities to stay in or near New Mexico.
That's a very New Mexico specific turn of events, though, isn't it? That idea of more residencies, Harry, because we haven't had any changes on the numbers as designated by our federal government since 1997.
Exactly.
It's incredible.
Yeah.
Go ahead.
Yeah, there's a whole set of systemic issues, and the residencies issue is just one of them. You've got the fact that this would be a private medical school that would have a pretty ambiguous relationship with New Mexico State, and then where are they going to be getting residencies? So I think it's a big set of issues, and Gene, you brought up the debt load previously. We clearly do have a crisis in primary medicine in the state, and particularly in the southern part of the state. But are these people going to get residencies, and then are they going to be able to handle these debt loads, serving communities like Deming and Columbus in the southern part of the state? I think there's a lot of really open questions.
The idea of, first of all, Rob Nikolewski, of the osteopathic school versus other types of medical schools, there's a bit of a difference there. We might all in our personal lives know folks that choose one or the other. Is this the solution for New Mexico specifically, osteopathic route as opposed to primary care and other types of medical work?
I'm not a doctor and I don't play one on TV.
There you go.
But I would say that any little bit helps, because we've got a real demographic cliff that we're falling over in New Mexico. Laura mentioned the fact that we've got a lot of doctors who are over the age of 60. Also, we have an aging population, even before this happened. And then you had on top of that the Affordable Care Act, the expansion of Medicaid. I mean, more and more people are going to need medical services, and the fact that New Mexico's got it's a small state population-wise, but it's a big state as far as area goes. And for your rural communities, this is really badly needed. And I think one thing that I know that if you look at things with a critical eye, and we always should, when you take a look at this private medical school, maybe there are some issues that might need to be addressed. But at the same time, the driving force behind this, Mr. Burrell, is from New Mexico. So it's not like this is an outsider who's coming in, and maybe if it doesn't work, he's going to pull out or something. This is a New Mexico man with New Mexico roots. So I think this
He's
is
made his money here in real
Yeah.
estate and other
right.
types
So
of things. Sure.
I don't see, even though I look at everything with a critical eye, I
Sure.
really don't see a whole lot of downside at this point.
Sure. Go ahead, please.
Well, one thing I will add is,
Mm-hmm.
you mentioned the osteopathic versus the allopathic method. Osteopathic model really focuses on primary care education and community, building community ties, so much more of community medicine. And I think for being trained in that model is really advantageous for some of our rural areas, and hopefully will help increase the number of people who stay in New Mexico. I think right now the statistics are 39% of graduating UNM medical students stay in New Mexico. What some of these projections are based on this new school is that within 8 years they're hoping to have 50% of the graduating students stay here. So that would be about 75 more students or more doctors staying in New Mexico per year starting in 2020. And then the other issue for me also is that it's a shot in the arm in terms of the economic development in that area. So $26 million in construction, which translates to 377 jobs. That's just for the construction of the school, and then 75 full-time faculty with a total of 162 employees of the school, and then 288 indirect jobs, so other types of support jobs, supplies, food, transportation. So it is, not just sort of a new school and then all the money goes out. There's waves of economic potential that could come out of this.
Here we go again. The university being the honest third broker in a
Right.
community. You know what I mean? It's supposed to churn this way.
Right, very,
University.
yeah, and I think the point that Laura made about economic development is a really important one. These aren't just jobs, but these are going to be very high-paying jobs, and there is, I think, a lot of promise, with this partnership. But it just seems to me that there's a lot that needs to be worked out. So let's say, God forbid, something bad happened at the medical school. The graduates didn't, produce nearly as well, or weren't very good at passing their exams. I mean, who's going to take the blame for that? Is that going to be New Mexico State? Is it going to be the school? So New Mexico State is getting some ongoing revenue from the medical school. You've got the possibility of joint programs. That would all be to the good. But I think New Mexico State also has to think about its brand name.
Interesting. Let me circle back to something you brought up, Rob, and that is the fellow that's behind this. You don't often see family money like this in New Mexico to this, level over the course of some years, in the course of some depth of time. But it seems to me there's something, a danger. Over the course of 30 years, a lot of things can happen in a family.
Oh, yeah.
You know what I mean? A lot of different ideas the new generation can come up with how to spend the family dough.
Right. Well, the fact that also that this is going to be a private institution, privately funded, they've got a lot of monetary incentive to make sure this thing works.
Right.
I think another aspect to this as well is that so many times the southern part of the state sort of gets the short end of the stick. This is something that where the southern part of the state is going to be able to have a medical school, and also its proximity to Texas and to El Paso. I think you'll be able to have a bigger market or a bigger pool to choose from than we might think of.
What do you make of the idea that somehow it's going to be impactful on UNM Med? Not just the residencies, but in other ways, pulling for students, pulling for the best students, that kind of a thing.
Well,
is there some kind of impact we can anticipate here?
There is a shortage or too small a number of residencies that are being handed out. But from what I've read, though, that's up to the federal government. And I would think that the federal government's going to have a lot of incentive, especially with the Affordable Care Act, to try to get off the dime on that.
Sure. Again, the idea of UNM Medical being somehow impacted here in some kind of soft way. Can you anticipate anything that might be on the horizon? I mean, this place is not going to open next year, but there's something could happen.
UNM Medical School is one of the top schools in the country. I mean, it's competitive. I think the people who come out of there are just as competitive as anywhere else. And the residencies are a huge concern for everybody across the country. So I think if it were competing with UNM and it was there wasn't an expansion of potential residencies, that would be a serious problem.
Right.
And something that the regions should be concerned about and everybody in that community. But this seems to be something where they're trying to work within the community, try to expand the pie instead of taking away from what UNM does, and hopefully that will mean better opportunities for everybody.
Exactly right.
One of the things I wanted to say just in terms of the Burrell family.
Yeah.
So I think in New Mexico it's unusual that we see a family committing this much long-term money,
Right.
but it's not unusual for medical schools around the country. I mean, I went to UCLA. UCLA Medical School got a huge gift from David Geffen, who made his money not in medicine, but through movies. And he, now it's the Geffen School of Medicine at UCLA. it's not unusual that we see these large endowments to other institutions. It's just unusual here in New Mexico that we see this kind of long-term money being committed. And I think it's a great move forward. You know, it's a great private-public partnership that could really expand
I appreciate
things
you
in
bringing that
region.
back up, because that's what I wanted to get to. Perhaps some other families might see this as well. Right. You see what I mean?
Maybe the Ways.
Yeah, exactly.
Maybe Alan Way.
Alan Way. 560 large. You never know. Thank you all for being here. See you next week. Join us next week when we talk with Game of Thrones author George R.R. Martin. Don't miss it. And as always, all of us here at New Mexico in Focus appreciate your time and your effort to stay informed and engaged. Catch up with us anytime on social media by searching New Mexico in Focus. And you can find archived interviews and bonus material from our shows on our YouTube channel and at newmexicoinfocus.org. I'm Gene Grant. See you next week in Focus.